of the Medicaid and CHIP continuous coverage requirement. So just like Laura said, we're welcome. This is a welcome to all, but I do want to give a special welcome to CHIP MCOs who are joining us for the first time today. Our CHIP transition occurs on 4/1, so DHS will take on the eligibility side for CHIP cases at the same time as the unwinding. So CHIP MCOs, in light to this webinar, will receive the same reports as our group here, and the ask for outreach during this time will be similar. So we're happy to have CHIP join us for this webinar, and this webinar will reiterate and expand upon our outreach discussion so far. We have a lot to share since our last update, so let's move right into the agenda. So we'll start off with some introductions and move right into some information about the end of continuous coverage, the unwinding process and general timeline. I know a lot of you had questions surrounding some of that specifically, so we're happy to address those. We do have some online resource demonstrations for you today and some expansions to things that we've put out in the past. We have some information and expansion on member outreach, general requests from DHS, content review from DHS, outreach files and how to use them, special guidance for general outreach and communications on companion QHPs, and some reporting outline and guidance. So moving from there, we'll go to general communications. Plan outreach guidelines and files, address reporting updates, and some Q&A. So that's what's on deck today. Moving forward to our presenters. Our presenters today, you'll hear from Allie Fogarty, our Director of Communications for DHS, from me, Executive Assistant for DHS in the Office of Income Maintenance, Lexi Dyson-Roth. Nicole Silks will also be joining us from our Division of Health Services in DHS, in the Office of Income Maintenance, Bureau of Policy. Kristen Figueroa is our operations manager in OMAP, Bureau of Managed Care Operations. Lloyd Buchter is our welfare program executive out of OMAP as well for Bureau of Data and Claims Management. And Chachi Angelo is our representative from Penny. He's the director of external affairs. So for now, I'm going to pass the ball to Nicole Silks to get us started with the end of continuous coverage.
Good afternoon, everyone. On this slide, I'm going to review some information related to the Consolidation Appropriations Act and how that impacted the continuous coverage requirement. So what is the continuous coverage requirement? And I'm going to refer to it as CCR and continuous coverage requirement. I might go back and forth, so just to let you know. The CCR is the portion of the Families First Coronavirus Response Act that permitted states to claim a higher federal match rate as long as they continued Medicaid eligibility for all individuals who were enrolled on or after March 18th of 2020. So what happened to the PHE? Because we've been talking about the PHE for months now, and now we're talking about the continuous coverage requirement. So what happened to the PHE? Well, on December 28th of 2022, President Biden signed the Consolidations Appropriations Act of 2023 into law. The act included, among other things, an end to the continuous coverage requirement effective April 1st, 2023. The act separated the continuous coverage requirement from the PHE. And so for this reason, DHS is now referring to this as the continuous coverage requirement ending and not referring it to as the PHE ending. I do want to note, though, that on January 30th, the White House did announce that they plan to let the COVID-19 public health emergency expire on May 11th. So that will also end in the coming months, as well as the continuous coverage requirement. So what are the implications? With the ending of the CCR on April 1st of 2023, DHS will start what we call our unwinding period. And that'll start on March 1st of 2023. And that means we're going to initiate our ex parte review of cases who have an April renewal date. We can go on to the next slide. So this slide is going to give you a little more detailed view of how renewals and closures work once the CCR is over. Medicaid and CHIP individuals who are maintained due to the CCR will have an opportunity to have their eligibility reviewed during the 12-month unwinding period. During the renewal processing, they're going to be reviewed for ongoing eligibility or for case closure. And individuals cannot close until they have a renewal process. So this COVID maintained population that we're talking about won't close until we get a renewal and review them for ongoing eligibility or for closure. Renewals are going to occur over a 12-month unwinding period that starts in March. And what this means is that the ex parte review for April renewals initiates in March. CAOs may start sending ineligibility notices in the middle of April with the closure date as early as April 30th, but we expect the majority of closures to begin in May, since any processing after April 15th will put the 15-day advance notice of closure into May. So though there is the potential for some closures in April, the majority of cases will start the closure process in May. And for most recipients, these renewals are going to occur in the regularly scheduled renewal month. So all we're doing is shifting the year date out. So if they have a renewal in June that was from June of 2020, we're going to move it out to June of 2023. The only population who will have their renewal date moved that could be a different month would be the SNAP and MA recipients whose renewal dates aren't aligned. So we're going to realign the MA renewal date with the SNAP renewal date to make some efficiencies in case processing. I think next I'm going to hand it over to Kristen. Nope, Lexi, sorry.
I think it's coming back to me. Thanks, Nicole. I'm sure most of you are already familiar with our PHE landing page. We launched this in early of 2022, but if you're new here, you can visit dhs.pa.gov/PHE. Here you'll see our common communication themes outlined in a way that's friendly to recipients and stakeholders to provide insight as to what's going on and how to prepare. Links from our landing page navigation are shown here and include our DHS helper portal. And that is a portal where you signing up to become a helper gets you listserv emails with updates from the department and ways to support DHS in the unwinding. Previous emails are linked on the helper page that we've sent already and can give insight to previous information we've sent to helpers. We are sure there is more to come throughout the unwinding, and signing up to be a helper is one way to stay up to date on all the changes and calls to action from the department. Our next section here is stakeholders, resources, and toolkit. And I think you will see that we are soon posting a little makeover to this section. So we will walk through the contents of the toolkit in a moment, but the toolkit includes ready-made communications from the department that you can use or update with your branding to easily communicate to your members with pre-approved messaging from the department. The glossary. The glossary was developed to ensure that we maintain consistent language in our DHS communications. Some of you that have submitted communications for approval may have seen some edits to ensure consistency of terms. This page can help you if you are choosing to develop your own communications for the unwinding when we reach the document review process. So that's something that you may want to keep an eye on if you haven't seen it already. FAQs. This page was created to provide answers to some of the most commonly asked questions about the unwinding. And last but not least, MA and CHIP recipient communications. I'm actually going to walk through this. This is a list of communications that recipients will see and when throughout the unwinding. So let's head there now for a short demo. We can move on to the next slide and we can visit that site and we'll walk through it together. Okay, so as we've indicated before, MA and CHIP recipients will not all receive renewals at the same time. This process will occur at the regular renewal time over the course of 12 months. Renewals will occur when a recipient's that annual renewal is due, and this isn't a new process unless you are new to medical assistance or CHIP, as DHS has continued to send renewals throughout the public health emergency. The renewal process starts approximately 90 days ahead of the renewal date. So that's where our site here starts. 90 days before the renewal date of a recipient's annual renewal, they're going to receive a change reporting flyer called the CM 537. So we can scroll down. That's our first thing here. This flyer is designed for them to report changes ahead of their renewal. In 2022, we updated this form with adapted language on the backside of the form that encourages recipients to sign up to take advantage of electronic ways of benefit management by signing up for Compass, downloading the My Compass PA mobile app, and opting into text messaging. You'll see that throughout the Unwinding, we have layered messaging onto all of our usual mail communications using additional modalities. These modalities include email, text, and what we're calling our helper call. Its first 90-day call to action. So you see the CM 537, but directly below there is where you'll catch those other modalities. In this call to action, individuals will get the CM 537, but they'll also get an email, a text, a helper call to reinforce the need to keep contact information up to date with the department. This will ensure that individuals receive their renewal in the mail or will be prompted to renew via the other modality. Yes, are shown by individual or linked here, and you'll see with the helper calls there, the scripts are available there. Okay, so moving along to like the 60-30 day out from renewal date timeline, the renewal process goes to like our next theme of messaging. Do your renewal and here's how. Just like our first set of messaging aligned with our change reporting flyer, our next phase occurs 30 to 60 or 60 to 30 days before the renewal date. It aligns with our mailer, the targeted mailing number 1. So targeted mailing 1 is a letter that prompts recipients to complete their renewal and includes instructions on the several ways to do so. This mailing also includes a short FAQ on the importance of completing a renewal and informs individuals of options for coverage if they're no longer eligible. In addition to that mailing, MA and CHIP recipients can expect to receive, again, an email, a text, and a helper call. Those layered modalities, all that help to reinforce that a renewal is coming, the urgency of completing that renewal, and the many ways to do so. So that's our next chunk of messaging. And then we then get into our regularly scheduled renewal communications, approximately 30 days before that renewal date. This starts with the renewal packet itself and the associated forms that go with that. This also comes with a layered text nudge that is sent to recipients that have opted into text messaging to let them know that their renewal has been mailed and how to start the renewal via Compass. Closer to that renewal date, recipients may see a second text nudge if their renewal hasn't been processed yet. And that reminds them to complete their renewal if they haven't done so. Okay, so now we've gotten through the renewal process. So after the MA renewal has been processed, they will be found eligible or ineligible to continue to receive MA and or CHIP and will then receive a notice telling them their result. If individuals in a household are ineligible for MA and or CHIP, and all required information was used to process that renewal, they'll get a referral to Penny, the official state marketplace for health insurance options. Information about this referral will be included in a separate mailer. included with that notice, a separate letter that's included with that notice. If a household was ineligible because they failed to return the renewal or other necessary documentation, also known as like a procedural termination, they will not receive a referral to Penny. These individuals will receive MA and CHIP recipient targeted mailing 2, and they'll also receive a mailing from Penny shown below. So they won't directly get sent to Penny for review for MA of Penny, but Penny will contact them. So that second targeted mailing goes to individuals that didn't provide their renewal or provided the renewal, but not all that required documentation was there to process the renewal. This letter is going to let individuals know they can still provide the renewal and other necessary documents to us within 90 days of the closure to be reconsidered for medical assistance without the need to submit a new application. The Penny mailing will be sent to those same recipients and is an educational mailing to inform recipients that Penny is a source of affordable medical coverage. This also reinforces that if a person were to apply to Penny, but it looks like they'll be eligible for MA or CHIP, the application will then be forwarded to DHS to review as a part of our open door application process. So those are the planned communications to recipients from DHS throughout the unwinding of continuous coverage. Our hope is that your outreach complements DHS outreach in timing, call to action, and language used to provide consistency in that beneficial layering of communication touches to recipients during this time. So now we'll walk through our stakeholder toolkit to show you the lay of the land when it comes to what we've already created for you to use to communicate to your members during the unwinding. So now I'll pass this off to Ali Fogarty, our Director of DHS Communications.
Thanks, Lexi, and good afternoon, everyone. So we have reworked our stakeholder toolkit a bit from how you've been used to seeing it. Laura, if you could scroll down a bit. We've restructured the materials into 5 phases, for lack of a better term. We have just general information on the unwinding, information to encourage Medicaid recipients to keep their contact information up to date, information for when they can complete their renewal early at the 60-day point, information for when their renewal is due when they're in that month, and then information and resources for if they are no longer eligible for Medicaid. We are working on a timeline that lays out when these can go out based on the 90, 60, 30-day communications chains that we have with our Medicaid recipients, and then also a general outreach that each of you can be doing to your members, to your provider networks to support this, the community-based organizations that you work with. Right now, that format is in an Excel spreadsheet, so I'm not going to show it on here because it's probably going to create more confusion than anything, but it's something that we're working on getting into a cleaner graphic that will live on this page as well, but I'm going to share it with the group from the managed care organizations that meets to discuss communications on Friday, so we can walk through it, see how it's helpful for you, and that should be coming out, if not today, tomorrow morning ahead of the Friday call. Our goal is to give you recommendations on how you can align your outreach with what's going to be coming from DHS. And there's a number of resources under each category. As we've kind of restructured, there's going to be more that we have to add here. So everything you see now is going to be expanded upon, and we can make sure that we send you these resources when they're in a more final state. But as we've said, since we started these conversations last year, there's anything that you're not seeing here at any point during the unwinding, anything that you've identified could be helpful for your members, please contact us and we can make that available, because we want all of us here at the state level, each of you, be using the same messages. So when we reach out to recipients, they're getting the same general talking points. They're seeing the same things. We're building that awareness with shared materials. So any way we can help, we want to make this a resource for you to try to make sure we're all working from the same items. So all that to say is more to come soon here, but we have heard some feedback that we want to make that it would be helpful to make this a little bit more specific and actionable. So we are in the process of restructuring towards that. I think, Lexi, am I turning it back to you?
We are going
I
to
believe
kick
we're-
this back over to Kristen Figueroa. But first, I can take the question in the chat. I know we'll probably loop around with most of these at the end, but CHIP members, once they are transitioned to the Office of Income Maintenance, will receive the text nudges for renewals. The FCC did just put out a clarification that we do not need permission at the state level in government to we don't need permission to text our individuals regarding information about their benefits. So we actually opted everybody in and they will receive that unless they've specifically opted out when receiving those texts. So that is the answer to that question, and I'll pass that over to Kristen.
Thanks, Allie. Thanks, Lexi. Good afternoon, everyone. DHS is encouraging all health plans to work with their beneficiaries to ensure their contact information is up to date so that members receive all of the necessary communications from DHS. In regard to member outreach, some general messaging to your plan participants can assist them to sign up for a MyCompass account and or download the MyCompass PA mobile app as an added way to manage their benefits. We also encourage reminders to participants to update their contact information with DHS and complete their renewals when received. We also strongly urge you to direct participants to sign up for text and email communications through DHS so they can receive timely updates about their medical assistance renewal and other benefits. Stakeholder toolkit resources that were discussed previously can be used to assist with targeted messaging that focuses on recipients with an upcoming renewal. Some of the things that these resources emphasize are that a renewal is coming, the different methods that can be used to complete and return a renewal, as well as locations where recipients can receive assistance completing the renewal materials. Best practice, through focus groups and research done by federal partners, as well as some feedback received from local advocates and recipients, making reference to the terms continuous coverage or public health emergency, or the PHE, is largely unrelatable to the target recipient. While these terms are accurate and relevant terms for the times, ensuring communications are relatable is certainly a goal. We encourage limited use of the terms continuous coverage and PHE in your outreach communications. Next slide. Next slide. Oh, thank you. MCO members that have been determined to be ineligible to receive medical assistance benefits will receive notice telling them such. Per CMS guidance, MCOs may contact former enrollees who are losing eligibility for procedural and non-procedural reasons. For those members who lost eligibility for procedural reasons, MCOs may outreach to them to offer assistance with curing any procedural defects as long as it is clear that they are not attempting to induce the member to enroll in their plan. For those members losing eligibility for non-procedural reasons, the MCO can inform them of their qualified health plan, QHP, offered on Penny, with the caveat that it is to be educational, not influential, and must also include general reference to Penny in addition to the MCO's offered Penny plans. A Penny representative will speak more to this in a later slide. Of note, the MCOs will receive member eligibility information on the daily 834 file. MCOs may outreach to enrollees losing eligibility as long as this is done before the disenrollment is effectuated. So there's a limited window of opportunity for this type of outreach to this specific population. Outreach should occur while the member is still enrolled with the MCO and is defined as an enrollee with the MCO. So for example, if a member is determined ineligible on April 8th, their MCO enrollment would be valid until April 30th. And the MCO should conduct this outreach after April 8th and prior to April 30th. MCOs would be responsible for following the outreach timeline within their contract with the medical assistance agency, again, being specific to the window of time the member can still be considered a quote unquote enrollee. Next slide. When drafting materials for outreach, please consider and include the following details and information with your submission to the contract management team for DHS approval. Who is the audience? Providers, members, specific group members? What type of communication is this? A flyer, letter, email, call script, etc. When do you plan to launch the communication? Where will the communication be going, located? Are you directly sending it to MA recipients, posting in a provider waiting room, etc.? Why? What is the purpose of the communication? MCOs should continue to submit outreach materials through the contract teams at DHS for approval prior to distribution. Word documents should be used for submission for ease of editing. And also just adding a reminder that the stakeholder toolkit has been created to ease the burden of messaging for MCOs outreaching to individuals about the unwinding and renewals by creating pre-approved language for communications. If you are using communications from this kit during the submission process, indicate if materials in the submission were pre-approved from the DHS stakeholder toolkit. As we reviewed earlier, this will expedite the review process with the DHS contract management teams considerably. Nicole Silks with the Office of Income Maintenance will now provide some information on the outreach files available to the MCOs.
Okay, so as you know, DHS has provided reports of the COVID flagged and overdue cases to all MCOs and life plans thus far. So you've received a couple files, more than a couple files throughout this process to keep you updated with your beneficiaries. In the next slide, Lloyd is going to discuss the reports a little bit more, but I wanted to note that overdue renewals occurring in months of past years are going to be moved forward the 12 months, 24 months, or 36 months that they need to be to align them with the 2023 or 2024 renewal date. For example, if an overdue case in your file has a renewal date in July of 2021, it'll be moved forward to a due date of July of 2023. These updates have been made, and Lloyd will explain the 834 file changes next. And like I mentioned earlier, the misaligned SNAP and MA combo cases are the only exception, and the renewal date will be moved to the SNAP date. But again, Lloyd's going to go over a little bit more of those changes and what you can expect to see coming up. Oh, one more thing I wanted to mention on this slide, sorry, is that CHIP is going to provide any additional direction if renewal dates for the CHIP households are affected because of the CHIP IT transition. So as of now, everything's aligned, but if anything changes, more information will come. Over to you, Lloyd.
All right. So as was mentioned before, renewal dates are going to be changing. As they're changing, they'll be done in two phases. Phases can be done this month, and when they're adjusted, they will be pushed to the 834. So the MCOs will have these updated renewal dates sent to them on the 834 so they can update their internal systems. A second update, if needed, will be done in April. They'll be at the same time the final COVID flag report will be released to the MCOs, and that will also drop to the 834. We don't have exact dates on when this is going to happen because they have to do testing with this to make sure the process works correctly. But by the end of February and April, these will all be pushed to the 834 so MCOs can update their system. As far as CHIP MCOs, of course, when they come over to our ESIS system after the weekend of the 18th and they receive their first 834 from us March 20th, either evening of March 20th or morning of March 21st, those renewal dates that have transferred over from the CAP system will be populated on the 834 and sent to you then. I think we're ready for the next slide for Kristen.
Thanks, Lloyd. With the file information that's being provided, DHS is encouraging MCOs to continue your normal renewal outreach to all of your members, but with some added communications that can be used to layer on to the DHS outreach materials that will be sent. For COVID population outreach, the COVID files issued previously and the updated file that will be sent to the MCOs in April can be used if the MCOs choose to target certain communications to the identified vulnerable groups of members that have been maintained with medical assistance due to, one, an overdue renewal, which indicates the member hasn't returned a previous renewal or additional documents, or a COVID flag, which indicates that a member failed some element of eligibility and has been maintained because of the public health emergency requirements. Next slide. DHS wants to ensure appropriate continuity of care and coverage for all medical assistance recipients throughout the unwinding period. This desire is in the interest of our clients, stakeholders, and the agency itself. As the health plan managing care for your members, you may be aware of members that due to disability, illness, or other life circumstances are challenged in their ability to respond and complete the eligibility process. Your work with this population through care management services, coordination with case management, and providing service coordination and personalized planning to assist them to complete their renewal is in no way inhibited by CMS regulations. The CMS rules that prohibit outreach targeting specific members or classes or Medicaid categories is not intended to prevent the provision of needed assistance, especially to special populations. MCOs may provide specific outreach and assistance to those members at risk of failing to complete their renewals. This is not considered to be a violation of CMS rules. If you have questions about this limitation, please let us know. Again, outreach materials must be educational in nature. Material may not include intent to influence the beneficiary to enroll or disenroll from a managed care plan. And MCOs may provide specific outreach and assistance to members at risk of failing to complete renewals. And now we're going to hear from Chachi with more information on outreach, including Penny.
Thanks, Kristen. Hi again, Chachi Angelo, Director of External Affairs with Penny, which is Pennsylvania's health insurance marketplace. So we've been working very closely with our partners on this call and others throughout the Commonwealth of Pennsylvania. So I appreciate the team including me on this webinar as well. So CMS offered guidance to states to allow the ability for those states to authorize MCOs to do outreach to plan members about affiliated QHPs that are available through Penny. So DHS will permit MCOs to do that outreach to plan members about their affiliated QHPs. However, that communication comes with some caveats. Not to target specific members or member classes, must be educational rather than persuasive. Include direction to Penny along with any affiliated plan link. Must be approved by DHS and the folks here at Penny. So please submit materials for review through your contract management team in the normal course of business. And we have some approved copy that is included in the stakeholder toolkit under Penny. And I think that the main thing that I'd like for you to take away from at least my slide is that our hope is that you provide as much information as possible to your members about what will happen if they are deemed ineligible for medical assistance. And that's all listed out in that approved copy for the stakeholder toolkit. Our hope is that there isn't vague language, as in we'll help you find coverage elsewhere or just pushing off to Penny, but really kind of walk the members through the process of what really will happen with their information and the communication that will come from that. So please make sure that you check out the approved copy in the stakeholder toolkit that Lexi and Ali alluded to earlier and walked through, because that is really what we're hoping is included in your member communication to let your members know that if they are deemed ineligible, there is a path laid out for them. And I think I'm passing it back to Kristen. Thank you.
Thanks, Chachi. Something new for this webinar that was not included previously, in follow-up to the outreach conducted by the MCOs, DHS is going to be asking for feedback from each of the MCOs regarding your outreach efforts. Feedback will be requested via a pre-formatted questionnaire. The questionnaire is going to be an online form that's going to be submitted by each individual MCO by plan code, zone, or region. The intent of the questionnaire is to collect data about both planned and completed outreach by specific communication methods, so mail, telephone, etc. DHS would like to have the questionnaire completed and submitted back to DHS monthly throughout the unwinding process. So each month's questionnaire should include data from the prior month's outreach results. So for example, outreach in April, reporting would be due in May, and so on and so forth. The questionnaire is currently being formatted by DHS and will be distributed as soon as possible, along with instructions for completion and submission. So Lexi, I believe it's back to you.
Thanks, Kristen. So in addition to expanding your regular outreach and implementing any targeted outreach plans to the COVID and overdue cohort, plans should encourage members to sign up for emails and texts, make sure their contact info and home address are up to date with DHS, and use the Compass website and the My Compass PA mobile app where possible. Other efforts include liking and sharing our social media posts on the topics and the toolkit. Can't stress it enough. Toolkit resources are available to help with this. And one huge takeaway I hope is that if more is needed, please let us know. You know, if there's something that's missing from our toolkit, we're happy to expand and ensure that language is consistent and reduce the efforts in the approval process for you at the same time. So we'd love to be able to help with that. So with that, and information on address reporting updates. So I'm throwing this ball back to Lloyd so he can report out there.
All right, so I think hopefully at least from the MA side, system notice was released showing the new form that has been created for this process and explaining a little bit more about how the process is supposed to work. The major change that is occurring is that when you receive a piece of returned mail, but you unaware of the address, you still submit the normal weekly alert so that the CAOs are notified that there's been some returned mail and they have to do some outreach to the member. If later you find you get a address from the person, they call you, some sort of outreach is done to them to find out what their new address is, you can go ahead and complete that form and send it to the CAO right away. So you don't have to wait, 30 days to do that. And then the only 30-day trigger will be after you send the form to the CEOs, you aren't seeing the address updated, you then send them to the membership management resource account, which is listed on the Health Choices extranet as well as on the systems notice. I think if we can go to the next slide, we have what the new form looks like. So hopefully this has been made a PDF fillable form with some drop downs in there for the plan codes, the counties, the districts. Asks for new information such as email address, I think for the recipient if it's a known, as checkboxes. The key other big difference is at the bottom where we're specifically calling out how you obtained this new address information. Of course, we're looking for you talk to the head of household, and that's how you got the address information. But there are check boxes there that you can check off, and if you got it some other way, of course, you explain it. I think that's it. Go on to the next slide. Oh, questions.
Thank you all so much for this presentation. So I just wanted to kick it over to my colleague Brandon and Lexi to determine. I know some questions have been coming in through the chat, so if you all would like to facilitate that at this time, let us know, or if there are next steps, also, if you could please let us know that. Thanks.
Thanks.
Okay, go ahead, Brandon.
No, I was just gonna, Lexi, do you want me to read some questions and you can answer them?
Yeah, that sounds good. We can give that a shot.
Sure, sounds good. So, I know you wanted to mention something about all of the SNAP questions.
So some of the SNAP questions, we may have to hold off on some of those alignment with the SNAP budgets. I know there are some caveats to CHIP. I want to make sure that we have the right CHIP information and before we answer some of those. Nicole, are there any of those kind of SNAP bundle questions that we can answer at this time?
I think so, because we can speak in generalities,
Mhm.
even if, so let me pull up my right window here. I think there was one where it said, it is my understanding some SNAP renewal dates extend through 2024 and 2025. How does the alignment work for those? So all maintained renewals, the MA renewals have to be completed within the unwinding period. So all renewals will be initiated by February of 23, and all actions have to be completed on that case all renewals will be initiated by February of 24, and all actions have to be completed by April of 24. So all MA renewals that are maintained will be renewed within that unwinding period. So if the SNAP falls outside of that, the MA would be done inside of that, the unwinding.
All right. Thanks, everybody. I'm going to go down the list that I have in front of me. I apologize if I skip over anybody in the order that they came in. But one of the first questions that I have here is, if a recipient appeals a decision, is the recipient's MA coverage temporarily reinstated during the appeal process so that the recipient can receive services?
And I can take that one, Brandon. If they appeal timely, there'll be a date on their notice by the time that indicates the time they have to timely appeal for their benefits to continue. Their benefits will continue until the appeal is heard.
Thanks. Next question I have is, if a family is no longer eligible for MA, but the child would qualify for CHIP, will the whole family be sent to Penny, with the children being routed to CHIP?
I can take that one too. Yes, so the routing rules can see if there's a child in the household or a family in that, or if it's a family that should go to Penny. So the children would be referred to CHIP if they're CHIP, if they look like they're CHIP eligible, or everybody would be referred to Penny. So there's eligibility rules, and the referrals go to the right place, and the noticing or the letter that goes along with the referral lets them know where they were referred to.
Thanks, Nicole. I think this next question may also still be for you. Is there any plan in place for MAWD MOD recipients who remained open but did not pay the monthly premium?
Yep, the mod recipients are following the same logic as the rest of the MA maintained population, so they will have their renewal date aligned within the unwinding period. And also per CMS guidance, that if there are any unpaid premiums that were incurred from January of 2020 onward, they will be, the individuals won't be responsible for those premiums. We can't require them to pay those back. So those premiums will be removed from they'll be given good cause for those premiums that incurred during the PHE, if there was any unpaid or overdue ones.
Thanks. We had a question come in. Can we please discuss the SEP requirements on Penny if they are disenrolled from Medicaid? There were discussions about a longer SEP window and possible retro coverage options. When will these decisions be made?
Yeah, Brandon, I can take that. Again, this is Chachi from Penny. Our board of directors have already voted on these decisions. So for those that are losing medical assistance, they will have a 120-day SEP to enroll in a QHP and 60 days of retro coverage.
Thanks, Jackie. Going through my list here a little bit more, we're having some questions come in. And I will say that if we do not get to your questions today, we will follow up at some point. Let me see.
I think our plan here too, if it's helpful to share, so we previously had the question library document that has been on the website, probably going back close to a year now from when we first started things. We've been holding off on fully updating that from the PHE language until this webinar was able to happen, so we could make sure that the new questions were incorporated. So I think everything will go into that document, and we will send an updated copy of it to everybody who registered and posted on the website when everything is finalized.
Thanks, Allie. I know we're getting a lot of questions coming in pretty quickly here. I know our folks are taking a look at those to see what answers we can provide at the moment. And again, like Allie said, the answers will be available in the future.
So one question I see here is when plans are doing their outreach for renewals, should we use the 834 files as a source for member renewals, as Lloyd mentioned, or the COVID files? Sometimes they were conflicting in dates. So I'm going to phone a friend here if I don't get this right, Lloyd, but what I do think is the 834 daily files are the most up-to-date and should be the source for that member renewal information, I think. And then the COVID files are from a point in time. So I'll route that back to Lloyd if I don't have that right.
Right. Yeah. So as I think also in the past when changes, data fixes were made to the system, they weren't always pushed 34. But after this February, that's going to change because we didn't know when this continuing eligibility was going to end. But now that we do have that date locked in, we can actually push this information to the 834, and that will become more of the file of record for renewal dates.
Thanks, Lloyd.
Lexi, I can take the one from Lindsay if you want me to take that.
Oh, sure.
Yep. So the question is PH00 going to remain a full dual code or will revert back to a non-full dual code after the PHE unwinding? And the response to that is that our Office of Long-Term Living did reach out to us. I think they had some questions from DSNPs on that previously. So you will consider the PH00 category to be a dual eligibility category through April 30th of 2024. So once our unwinding period is over, it's going to revert back.
All right, thanks everybody. I think we have time for about one more question. Let me go through my list here. And again, if any of our other participants see one that they can answer off the top of their heads, feel free to do so.
Brandon, I'll jump in on the next one that says, can we assume there won't be a drop-off cliff for members' disenrollments? Nobody is going to automatically close starting, April 1st. I mean, that's the message that we want people to be aware of. And the renewals are spread out over the 12-month period. So they're spread out throughout the counties, they're spread, so we're not expecting a drop off of all members, within a month or two, things like that, because the renewals are spread out over that 12-month period. When we were talking about our 6-month unwinding previously, that, there was going to be more of a concern with more people dropping off quickly. But with this, with it spread out over the 12 months, it's not going to be like just a cliff for individuals.
All right. Thank you so much, everyone. We really appreciate your time and joining us. Like we said, we will provide a recording as well as the slides after this call has ended, most likely later this week or very early next. In addition, we have been gathering your questions, and ones that we have not been able to get to, we will be sure to answer in the coming days. So thank you so much for your time. Thank you to our presenters, and we will talk to you soon.